going to get going. Welcome everyone to this Rural Health Equity Chat. It's great to see you all back again in 2026. I hope that you've had a good start to this year. So I'm just, for those who haven't been before, going to give a very brief introduction to what this Rural Health Equity Chat is. So I'm Dr. Veronica Rasic. I'm a rural GP. I founded a company called Rural Health Compass, and I coordinate the Rural Health Equity Group on the Health Equity Network. So this format, these chats, are really a space for all of you to come and share your experiences, listen to what other people are doing in rural areas around the UK and hopefully beyond, and just to give you a chance to share, learn from each other, and connect with each other. So I would like to encourage you all to quickly, if you want to, introduce yourselves in the chat. You're very welcome to share any links or emails with each other or have side conversations in the chat as we're going along. So the way that these sessions are structured is that we have a brief spotlight presentation, and today the presentation will be given by Emily Dodd, who is a senior research fellow at the University of West England, and she will be talking about her research into dementia and living with dementia in specifically rural and coastal communities. And after that, we will open the floor to everyone, and then you're welcome to ask questions, share your experiences, and just discuss whatever you feel is important. So I'm going to hand it over to Emily now. And please, Emily, go ahead and share your presentation.
Thank you. Thanks, everybody. I'm going to have to try and stop that from pinging. Right, here we go. Let's see if I can. There we go. Can everyone see that?
We can, thank
yeah?
you. Yes.
Can you see it? You can't see the notes section, you can just see the slides, yeah?
Just the slides, yeah, thank you.
Okay. So yes, thank you, Veronica, for inviting me to talk about the project that I recently completed. So yeah, I'm a senior research fellow at the University of the West of England in Bristol in the UK, for those that are international here today. I sit in the Centre for Public Health and Wellbeing. So I have a background in public health, and I'm interested in health inequalities. So today I am going to give you a little bit of background as to why I got interested in this project, what I did, and then what I found. And then I'm going to tell you a little bit about my engagement events that I then subsequently delivered, and then a little bit of what I'm thinking about doing next. So first of all, I wanted to just give a shout out to my partners who really supported me in this journey. So I worked very closely with Spark Somerset, who is the umbrella organisation for voluntary organisations in Somerset, in the west of England, and then the two dementia alliances over in West Somerset. So that's Watch It and the Quantox Dementia Action Alliance and Minehead Dementia Action. And then I also worked very closely with two other voluntary organisations in Cornwall, right at the tip of the country, with the Sensory Trust and Cornwall Memory Cafe Network. They really helped me with this project. So why have I got interested in this? So as I say, I'm really interested in health inequalities, and I've done a bit of work around health inequalities in dementia, particularly in South Asian communities, but also in stroke, in people from the Black African and Caribbean communities. And so I've always been slightly interested in rural and coastal areas. I live in a rural area. My nan was Cornish. She lived with dementia in Cornwall. So I have a sort of personal interest as well. And really, I started looking at some of this evidence to show that we recognise that dementia, the biggest risk factor for dementia is age, and there is and we know that the population of over 65s will increase by around 50% in rural areas by 2039. So that will tip the ratio of older to younger people in those areas. So potentially more people will be living dementia in those areas. And also that even the World Health Organization has recognised that we do need to do more research into these particular inequalities that are faced with people living with dementia in rural and coastal areas. So what was I trying to do with this project? So this is an internal project, an internally funded project. It's not a massive project, it's just a very small project, just to get me going in this field, in this area of rural and coastal living. But really I wanted to find out what do people living with dementia and their families currently access in these communities? What might they be missing? And what difficulties are people facing when they are trying to get support that they need? And I'm really interested in how the voluntary sector support people. So I really wanted to speak to people from the voluntary sector about their experiences of working and supporting people in these areas. And also I work very closely around the LiveDem intervention. So LiveDem is an 8-week intervention for people recently diagnosed with dementia, and people in the NHS and people in voluntary sector organisations deliver our course across the country and internationally. And so I asked a few people about their experiences of going to the course and how we might be able to think about how we might make it more accessible for people living with dementia in rural and coastal communities. So first of all, as I say, I'm really interested in more participatory approaches to research. And so I really wanted to look at how I could start fostering these collaborations with these voluntary organisations early on to support me. So I met with them a couple of times to share my ideas and to get feedback from them as to where I might take it, who might be interested in getting involved in the project, and getting fit to get to know each other. I think sometimes you need to sort of just sit down with a cup of tea and get to know one another, to get a bit of a feel of how things are for people working on the front line, I guess. And then we were thinking about how we might be able to work together and what they might be able to realistically do to support me in doing the research. So looking at maybe providing information sheets prior to me attending their cafes or coffee mornings, and helping me to think about where I'm best placed to speak to people, and in particular who might be the people that they think might be interested in taking part as well. So as I say, I didn't want to be what I've heard the term a mosquito researcher, where you sort of go in, you do your data collection, and then you're off. I really wanted to foster those collaborations and foster those relationships, because I feel like, you know, I want this to be an ongoing piece of work and really build on this initial project. So the guys over in West Somerset, they've been really, really helpful, and they really gave me some feedback on my information sheet as well as to how I might be able to improve it. And they also said, put your photo on it, because actually having a friendly face on a piece of paper sometimes helps people to see whether or not they want to get involved in something. So that was a really good little tip I found. So what did I do? So I went and spoke to people about their experiences. I'm a qualitative researcher. I'm really interested in people's lives and their experiences. So I tried to use different strategies and tailor to the areas that I went to, and work again very closely with those organisations. So in West Somerset, I was invited to attend existing groups. So I went to a Singing for the Brain group and got involved in some singing. And I even went to one of the organisation's birthday celebrations and spoke to people there about their experiences. And in Cornwall, I attended some sessions with the Sensory Trust. And we had a little focus group around a duck pond. The Sensory Trust are very into going out in nature and exploring nature with their group. So I went for a walk with the Wednesday Wanderers and around the duck pond, which was really lovely. A very different experience to sitting in a university office. So it was a really lovely experience as well, and I got some really rich sort of stories from people. So I'm really grateful for their time. So what I did, I analysed my data, and in no particular order. I'm going to give you sort of a run through of some of the findings that I had. And I'm sure a lot of people on this call will probably recognise a lot of some of these challenges that people face when living in rural and coastal communities. So one of the things that did come up quite a lot was this issue around transport and accessibility. And I know in one of our previous equity chats, we've had a conversation about transport in particular, but this quote was sort of really hit the nail, really, that, you know, if you haven't got a car and it's going to be really difficult because public transport in rural areas can be virtually non-existent for people. With the diagnosis, and again, this possibly is not specifically just around rural and coastal areas, but this idea that people get a diagnosis and then it feels like that's it. You're not told what to do or where to go next. It just feels like you're sort of left on a cliff edge. But people recognise the importance of those once they did get connected in with voluntary organisations. That sense of community and social connection was really important for people. Again, people recognised that they really weren't offered anything, so this feeling of being left, being given lots of leaflets at times, but not really explaining what these leaflets were about, and it was almost like just down to the person to try and sort of work out what they needed to do next and where to go. There was a lot of discussion around sort of that around digital inclusion, because I think sometimes we think, well, maybe that's one way to get people more connected, but very often it's not just about people's ability to use the internet or devices, but also about the Wi-Fi or the bandwidth. I know I had conversations on Teams with people, and people sometimes found, you know, we sometimes had difficulty with connection because of the Wi-Fi connection in more rural areas. And then when I was talking to the voluntary organisations, there was issues around how, you know, very often it's a one-man band trying to keep things afloat. And if they get ill, very often the group that's been running can be in jeopardy, and that they really sort of struggle at times to find volunteers to really support their groups. And then again, this feeling this is a perspective from one of the voluntary organisations, but this feeling that carers don't seem to have a lot of help, and they just don't really know where to turn to try and find that help. And this was a really quite an important theme, I think, around this health and social care coordination. So this came up quite a bit, this idea that people see lots of different people, but they don't really know who they are and where they come from and who they should go to ask about what particular problem that they might have. So they're kind of that coordination, and also that feeling sometimes. The voluntary sector people I spoke to very often felt that almost like the statutory services didn't really quite know how, weren't really coordinating with each other as well. So maybe there's something around how we might be able to improve on trying to tighten everything up and improve those pathways to connection. And then finally, there was lots of talk actually about sort of different activities, and I spoke to a couple of people that were experienced younger onset dementia, and this idea that for some people, not just the younger onset, they would like more physical activity options. So this is what was being offered in sensory trust with sort of the Wednesday Wanderers and the Ramblers. But there was sort of discussions around sort of trying to bring in more physical activity options and how we might sort of engage in parkrun as well as people living with dementia. So those were some of the findings that I found. And then what I've done is I have created an animation of some of my themes. So what I did was I looked at the data, I analysed the data, and then I wrote a script for a short animation. I took that back to my partners, and we looked at that, and we sort of refined it from their comments, and then I painstakingly learned how to use an animation software package, and I've created this animation to try and bring some of the themes together. So it's not based on one single person's experience, it's sort of a hodgepodge of experiences that people spoke to me about. So I'm going to hopefully share the video. Let me know if you can't hear it, and we'll try and work it out. Yeah. Oh, thank you. I can see hearts and claps. So thank you. That's very kind. So yeah, so I tried to sort of find a different way in which I can really share the findings from the project. But I didn't stop there. I wanted to take what I found and take it back to the people that that were very kindly gave me their experiences, and take it to other people as well. So I wanted to share the findings, but then work with people to think about, well, what's this telling us, and where is the priorities for these people that I might be able to then sort of take forward into my next research project. So I held 3 events, 2 in West Somerset, and where I went to existing groups, and a lot of those people that initially were part of the first bit were there, and then a separate event in Cornwall as well to share the findings. And then, as you can see, I had about 50 people in the end come to the 3 events. And then we did what's called a Diamond 9 prioritization exercise. So I don't know if you probably can't see these very easily, but I put the 9 areas that I recognize that I took from the findings. I put them on these little cards, and then I got people to work in little groups together. People living with dementia, their carers, people from the voluntary sector to work together to think about where do they want to prioritise, where would they sort of put these ideas on this diamond, with the one at the top being the most important. And as you can see, we've got this is taken from the group in Cornwall. It's a smaller group, but we did quite a lot of work. We had three smaller groups in that group, looking at the Diamond 9 exercise. And as you can see, we've got post-it notes as well all around it. So that was really helpful as well, to get people's thoughts on it. What I then did was I took those 12 groups, and I put them in, and I looked at all of what they were saying, and this is where sort of the average where the I collated them all to create this combination of the 12 diamonds. And so what consistently came up was these 3 areas that people felt more needed to be done, and more research could be done in trying to understand how we can unblock some of these difficulties that people were experiencing. So this idea of this idea of post-diagnostic support and diagnosis, but also during diagnosis. So I think sometimes because waiting times it can be quite a long process to get a diagnosis, some people felt that they needed more support during that period where they were sort of going through that process. But also this idea of sort of trying to connect the dots a bit better, and trying to connect so that people could navigate the pathway easier. And then thinking about the timing of information and how people get information, and knowing where to go for that information. Those would seem to be the key 3 that kept coming up, which is really interesting, because I thought maybe transport might have come up a bit higher, but that comes sort of sit slap bang in the middle, really. But I think that's possibly due to the people that I spoke to. And that's one of the things that I've recognised, is that when I spoke, the people that I spoke to had a workaround for their difficulties in getting to places. And that's one of the things I'd like to do next, is think about where I may have spoken to people through organisations that are already supporting people living with dementia. How can I speak to people that maybe aren't in that place yet, and find out if they are having similar experiences, or if they've got different experiences to those people. So I had a few reflections on the project. I think this importance of making that time to invest in those partnerships, and actually putting just the practicalities of budgeting, also the thoughts of when you're sort of working in a rural and coastal communities, you may need to travel yourself quite a long way, so making sure you've got the budget to actually make those journeys, because actually some people much prefer for you to be in person rather than always being on Teams. And this is the point I was sort of alluding to earlier, this idea that the connection was the main theme of the findings, and people felt at times very disconnected, but actually they were connected in some ways to things, because they were already working with organisations or being supported by them. And I feel that there's probably a gap there that I need to address around those voices that have not yet connected to those formal support offers. So I've been out and about sharing these findings. I've spoken at 2 Dementia Network events in Somerset and a carers event over in West Somerset. I've done a Dementia Awareness Week events. I'm also trying to infiltrate, if that's the right word, but speak to the people that are looking at the review in Somerset at the moment, the pathway review in dementia, and I've shared those findings, and think about how we might be able to take some of those findings to make sure that it sort of reflects the review that they're looking at. And I've spoken at the Only Connect symposium in Cornwall on the project. And so, yeah, I'm always interested in anybody who's interested in getting involved from lived experience point of view in the research. And as I say, I have written a couple of grant applications. I'm waiting to hear from one to try and take some of these ideas a bit more forward. So yeah, I think that's me. Yes. So yeah, thank you ever so much for listening. And here's my details if you're interested. And I'm sure that Veronica can send out the slides, I'm happy for my slides to be shared.
Wonderful. I will definitely do that. Thank you so much, Emily. I really enjoyed that little animation you did. I'm sure other people did too. I could see from the reactions. I'd now like to hand it back over to all of you and welcome.